In history taking, it's very important to see if the patient is decided or is doubtful. If the patient is doubtful, you can explore more about the causes that she wants to terminate, like if there's any problem in the partnership, if the partner is abusive or not, if there's any financial problem, and make sure to explore patient moods and look for depressive or anxiety symptom. If the patient is doubtful, there's a lot of online resources that you can offer the patient, and also make sure that you offer a non-directive counseling. If the patient has been determined on the decision, be sure to confirm the date of pregnancy, because some method of pregnancy, like medical method, can only be used up to 9th week of the pregnancy. Discuss available options for the patients and make sure to explore about symptom of STI. In medical abortion, if patient has an IUD and strings are visible, we can attempt to remove it. It must be performed before the week 9. It can cause strong cramps and heavy bleeding, so good support is required. The patient will need immediate medical review if significant blood loss or pregnancy does not terminate. The failure rate is 2 to 3%. Complication rate are similar to surgical abortion. For pregnancies up to 63 days, misoprostol, which is a prostaglandin analog, and mifepristone, which is a synthetic antiprogesterone, are used. The first dose, 200 mg of mifepristone, is given at Termination Center or by general practitioner. The second dose, 800 microgram misoprostol, is taken at home 24 to 48 hours later. If gestation is less than 49 days, 400 microgram misoprostol is adequate. The abortion starts 4 to 5 hours after second dose and may take 1 to 2 days to complete. Misoprostol can be given by vaginal, buccal, and sublingual route. This form of abortion is not suitable for patients who are older than 35 years and smoke more than 10 cigarettes a day or use an anticoagulant. If also the patient has a suspected ectopic pregnancy, any heart disease or hypertension or renal failure, liver disease, adrenal failure, or uncontrolled inflammatory bowel disease, or has an IUD that cannot be removed, this is not appropriate for her. Ensure the patient has analgesia and is aware when to seek help. Manage for miscarriage. If severe bleeding or pain, arrange immediate transfer to emergency department. If stable patient but pain and bleeding, refer to emergency department as well. Surgical abortion has similar cost to medical termination, and it can be performed after the 7th week. Sedation is required and instrumentation is involved. The procedure takes 10 minutes, then approximately 2 hours spent in recovery for early termination up to 12 weeks. For later termination, the procedure can take longer as prostaglandin gel is used to soften the cervix before dilation occurs. We should also give resist-negative women anti-D within 72 hours of the termination. All women should be visited again 2 weeks after termination of pregnancy to ensure the cervical screening test is updated. Check for the result of STI test if has not been already done. Ensure the correct use of chosen contraception method and condom use if it is indicated because of STI protection. Perform swabs if discharge is present. For pelvic pain and tenderness, treat using the PID protocol. In all women, especially those who have had an unwanted pregnancy, it's really important to talk about contraception and reliable contraception forms.